So you suspect you have a calf tear? If you haven't already, you may want to watch the previous video on testing for a rupture and a proper taping method. If you're ready for exercises, this is a video for you. Today we'll focus on exercises that you can start doing right away and continue on into the first few weeks of calf recovery. So as you can see below, I have my calf nice and taped and supported. I feel a really strong upward pull on all these fibers when I stand on my leg, and even when I step forward, I feel the tape yanking the fibers upward to keep that tear supported and closed up. It's not yanking apart even more with every step I take. That's why there's so much pain when you walk initially with a partial tear, because every step you take, the fiber's getting yanked apart and you're dying pain. So this feels really well supported right now. Now, most people tend to also have tighter nerves on the same leg. A great exercise to mobilize your nerves and help that torn, angry calf of yours be less angry is a seated nerve glide exercise. So Dr. Lin shows in one of his seated nerve exercises. We'll just review it here. You can do the slouching or sitting. You can try the slouching first. We're going to do a slowly kick up until it pulls up into your back. Feel the other side for comparison. And keep on going until you feel a release in the stiffness and the nerves going up. You might feel this pulling behind your hamstrings really well. Test yourself and see if you feel a bigger pull sitting. I feel definitely a bigger pull sitting. Okay, and then this will become your exercise then as you're trying to slide and glide your nerves back and forth. Your hamstrings typically are tighter on this side because the nerves are not so mobile. Do this until you feel a release. The next one is called a butts up exercise. Dr. Lin has also included this in his other videos, where you go down and grab your feet. You're slowly kicking your legs straight until you feel a nice pull up and through here, through the backside. And come on down, release, and straighten, and release, and straighten, and do this until you feel a nice release back there as well, and do that each day. Most people who have a slight calf tear also tend to invert their ankle feet during a calf raise. This is a bit imbalance between the inner calf ankle foot muscles and the outer muscles. This is most obvious during a heel raise, where the weight should be on the first toe knuckle, not the second, middle, or the fifth pinky toe. This imbalance indicates a tighter overuse of these inner calf muscles compared to other muscles, and you have a higher likelihood of this inside being stiffer and higher risk of tearing that. This exercise focuses on these needed outer muscles, your fibularii group. These muscles start on the outer of your leg and generally touch the outer edge, down underneath to the arch of your foot. These muscles support and your arch, give your ankle stability and prevents future ankle sprains. What you're going to do is place a resistance band around your 4 feet. I'm going to tie them together. Give myself a little bow tie here. Okay. Now, what you're going to do is start with your feet about hip width apart, okay? Toes up, and you're going to spread your 4 feet away from each other and hold this position for 15 seconds. Flaring your pinky toes outward, keeping your first toe knuckle grounded. And then super slow, come on in. And then draw it outward, 15-second hold. Notice I'm not using my knees. I'm not spreading and trying to do this. I'm not trying to do this, sticking my knees together. Your knees are nice and square and controlled. The only thing moving are my feet. Use a moderate resistance band and holding this and super slow coming back in. When you first have a new tear, you may feel excessive pulling up here. Give it a few days, then try this exercise again, especially after you've taped it and allowed this to heal together your first few days. Then try holding it 15 seconds and come back super slow. Do this about 10 times. When it gets easy, try for 20 seconds and super slow. And do that each day so that your ankle feet are in control. And when I stand up and try to raise up onto my heels, I've got good control over my first toe knuckle and I'm not inverting outward.
Remember, please see a healthcare professional who has experience speeding up the healing of a partial calf tear with their hands-on manual techniques, as well as retraining you back to sport. We'd love to hear your feedback and comments below. Let us know what you think of this technique. Hit the subscribe and like button if you want to see more of these kind of videos, and consider hitting the thanks button and leaving a donation. I'm Dr. Alison Wu, and thanks for tuning in.